Hi, I'm Monica Mehta, and I'm a first-year medical student at GW. Today I'm going to be talking about the new ACC-AHA guidelines. Feel free to interrupt me at any time if you have any questions. So last November, the American College of Cardiology and the American Heart Association released new guidelines for the treatment of blood cholesterol. And the last time that these guidelines had been updated was back in 2004, and they were called ATP3. So ATP3 was created in 2001 and revised in 2004. And just to give you a little bit of perspective on how long ago that was, 2001 was when the first iPod was created, and 2004 was when Facebook was launched. So it's been quite some time since they've looked at these guidelines. So let's first take a look at the ATP3 guidelines. Now ATP stands for Adult Treatment Panel, and that was the panel that created these guidelines. It consisted of people from the National Heart, Lung, and Blood Institute at the NIH. And the guidelines basically focused on treating LDL levels and making sure that they reached a certain LDL goal. Now you probably remember from biochemistry that LDL is known as bad cholesterol by your patients, and it's low density lipoprotein. So if you had a patient that had chronic heart disease, you would want to keep their LDL levels at about 100. And you would do this by doing multiple lipid panels and then adjusting their medication as needed to reach that goal of 100. But the problem with these LDL goals was that there wasn't much evidence to actually support their usage. In the past 10 years, there's been a lot of research done on statin therapy, and that's why the ACC and the AHA decided to come together to create some new blood cholesterol guidelines. So instead of focusing on goals, the new guidelines take a look at statin therapy, and they recommend using statins for 4 main groups of people. So at the end of this presentation, there's 2 main objectives that I would like for you guys to accomplish. You should be able to identify the 3 broad categories of statins as outlined in the new guidelines, and you should be able to identify the 4 groups of patients that would benefit from statin therapy according to the new guidelines. Okay, so statin drug therapy. The new guidelines put statins into 3 main categories: high, moderate, and low intensity. And basically, these categories are determined by how much statins lower a patient's LDL cholesterol. Again, it's important to remember that anytime you're talking about heart disease, lifestyle modifications are one of the most critical components to preventing heart disease. And so even if your patient is on a statin, you want to make sure that you're counseling them on making lifestyle modifications like diet. So the new guidelines focus mainly on prescribing high and moderate intensity statin treatment. So we're going to take a look at those just a little bit further. So the 2 main high intensity statins that you need to know are atorvastatin and rosuvastatin. And a good way to remember this is that the high intensity statins are the 2 most potent statins at their highest dosages. So atorvastatin is also known as Lipitor, and you would be prescribing that at doses of 40 to 80 milligrams. Rosuvastatin is also known as Crestor, and you would be prescribing that at dosages of 20 to 40 milligrams. Now, high-intensity statins are called high intensity because they reduce your patient's LDL levels by more than 50%. Compare this to moderate intensity statins, which only reduce your patient's LDL cholesterol levels by 30 to 50%. So these are all of the moderate intensity statins that you could prescribe to your patients. You see atorvastatin and rosuvastatin on this list again, but you have to remember that this would be at lower dosages than you had for the high intensity statins. Okay, so there are 4 main groups of patients that would benefit from statin therapy according to the new guidelines. So before, you were just trying to reach a goal. Now you have 4 groups of patients that would benefit from receiving statins. So we're going to go through each one of these more in depth. So the first group of patients that would benefit are patients that have a history of heart disease. So that means they've had a heart attack, they've had a stroke, they've had a TIA, or some other form of acute coronary syndrome. So we have this tired out heart over here, and if you have a patient who has had heart disease, you're going to prescribe them either a high or moderate intensity statin, depending on how old they are. So if they're over the age of 75, you're going to go with a moderate intensity, and if they're under the age of 75, you're going to give them a high intensity. All right, the second group of people that would benefit from a statin, according to the new guidelines, are patients who have either type 1 or type 2 diabetes and who are between the ages of 40 and 75 years old. So when I think of diabetes, I think of sugar. So here's a lollipop to represent diabetes. And if your patient has type 1 or type 2 diabetes, you're going to give them a moderate intensity statin. Group number 3. So now we're actually looking at the LDL levels, just like you would in the old guidelines. But instead of reaching a goal this time, we're going to say that any patient who has an LDL level of over 190 is going to be prescribed a high intensity statin. So this is one of the most drastic changes from the old guidelines because you're no longer trying to reach a specific goal. You're just going to go ahead and give them a high intensity statin if you see that their LDL levels are over 190. So let's say your patient doesn't meet any of the first 3 categories. They don't have a history of heart disease, they don't have type 1 or type 2 diabetes, and they don't have LDL levels over 190. So what you're going to do for these patients is you're going to estimate their risk of developing heart disease over the next 10 years. And if you find that their risk of developing heart disease is over 7.5%, you're going to give them a statin. And the way you're going to calculate their risk is by using a risk calculator. Now this is something new that the new guidelines have created, is this risk calculator. So let's take a look at that a little bit further. So the risk calculator is basically an Excel spreadsheet, and it's a little bit confusing to use at first because it seems like there's just so many things going on. But really, there's only a couple of things that you need to know from your patient in order to use the calculator. So you can even do this in front of your patient when you're sitting at your CAP doctor's office. You could do it with them. So in terms of what you're going to plug into the spreadsheet, you need to know whether or not your patient is male or female. You need to know their age, and you need to know their race. Specifically, are they African American? Then from their lab values, you're going to get their total cholesterol and their HDL cholesterol. From their vitals, you'll get their systolic blood pressure. And then you want to know whether or not they're being treated for high blood pressure right now. You want to know if they're diabetic, and you want to know if they're a smoker. And in terms of smoker, we mean, have they been smoking cigarettes in the past month? So you would input this into your risk calculator, and you would press enter, and it's going to give you a value for their 10-year risk of developing heart disease. And then you can decide if that's over 7.5, whether or not you want to start them on a statin. So let's say you're at CAP, and your CAP doctor tells you that they have a patient who has high cholesterol, and you're told to go in and do the interview on them. So what are some of the things you're going to want to make sure that you have written down when you go to present to your CAP doctor? Well, you're going to want to have, of course, the age, the sex, and the race of your patient, which you can basically just pull off of their chart. And then in terms of past medical history, you're going to want to know, have they ever had heart disease? So have they had a heart attack? Have they had a stroke? Have they had a TIA? Are they a diabetic? And are they being treated for hypertension? In terms of their social history, you need to know whether or not they have smoked in the past month. That's something you're going to plug into their risk calculator. In terms of vitals, you'll need to know their blood pressure. And of course, you do a lipid panel on them. And if their LDL is over 190, you're going to go ahead and start them on a high intensity statin. So one of the things you should know about the new guidelines is that they are pretty drastically different from the old guidelines. And one of the things that stirs a lot of controversy right now is the new risk calculator. So there were actually 2 physicians at Harvard University who wrote a commentary in The Lancet last year about how the risk calculator is actually overestimating risk. And as a result, we may be over-treating our patients with medication. So the AHA actually called an emergency session to take a look at the risk calculator, and while they admit that there are some issues with it, it's still a pretty big step forward in terms of treating blood cholesterol levels for patients. So they just maintain that physicians shouldn't follow it blindly, but look at your patient's overall risk to determine whether or not you should place them on a statin. So a couple of things to remember. There are 3 main categories of statins that the new guidelines outline. There's high, moderate, and low intensity. Remember that the high intensity, there's 2 main ones, atorvastatin and rosuvastatin, and there's moderate intensity, and there's a whole list of moderate intensity statins you could use. And then there's 4 categories of patients that would benefit from using a statin therapy. We have our tired out heart, so that would be someone who has a history of heart disease. We have a diabetic, so that's the lollipop. We have someone who has LDL levels of over 190, and then we have someone whose risk calculator shows that they have a 10-year chance of developing heart disease that's over 7.5%. So I hope that this helped clear up what the new guidelines are, and the next time you're at CAP, you can use this information to help understand what your patient is going through. And this is the end. Thank you.